Hey everyone, it's Professor Lee, and this is your supplemental learning case studies assignments for the signs, symptoms chapter, signs and symptoms and abnormal lab values chapter. All right, so the first thing we're going to do is scroll through these, read through them, and figure out what main terms we should be looking up. And then you'll see some examples of looking them up in the actual manual as we go through. So case study 1, on examination, this patient fell walking up her steps last night, states she is also having a severe headache since the fall. So they did the exam, they noticed that there's no swelling or other areas of pain. She was instructed to go to the hospital radiology department for a CT of the skull. Tylenol 3 was ordered for her headache. Patient will be contacted following results of the CT. So her diagnosis right now is just that she's got this severe headache. And so the main term that we want to look up for her is going to be headache. Now, this would be number 1. Headache would be number 1. Oops. And then if there's any mention of any modifying terms, then we would notate those too. But right now it just says she has a severe headache. So that's what we're going to look up. For case number 2, this patient was shoveling snow, became short of breath. Wife insisted that he come to the emergency room to be evaluated, states he has no other symptoms. And so for this patient, the main term we're going to locate is shortness or short. And then the modifying term that we're going to locate under short is breath. So 1 is yellow, 2 is blue. For case 3, patient is a 72-year-old male, presents today with complaints of abdominal discomfort, some shortness of breath, and pain, quote, in my gut, end quote. The patient denied any recent injury or trauma to the abdomen, says he feels fine, social history is positive for alcohol, times 6 per day, yikes, and cigarette smoking 3 times 1 pack per day. Ooh. So he's probably not the healthiest guy. And the diagnosis at this time is generalized ascites. And so that is what we are going to look up. We're going to only look up ascites. Oops. And if there's anything for generalized, then that's the code we'll pick. Okay. So case study 4, 8-year-old male presented today to the nurse's office. Yesterday to the nurse's office at school with a nosebleed that occurred on the playground. Collided with another kid. Other than the nosebleed, he was good. Went back to class. On exam, he's a normal, healthy 8-year-old male with evidence of a recent nosebleed. This time, there's a slight trickle of blood coming from the right ear. No serious problems. Does not complain of a headache. Does not have blurred vision. Any other pain in the head, neck. They packed his nostril and told the mom to bring him back if something else happens. So at this time, it's just a nosebleed that we are going to look up. Just so you know, nosebleed is also known as, oops, let me go back over here, epistasis. So if you can't find it on a nosebleed, look under epistasis. Okay? Case 5, I'm going to code this one with you as well. Miss Black presents today with complaints of feeling tired all the time. Upon questioning, she notes that for the most part her routine has not changed. So basically, if you read through this whole thing, you'll figure out that Miss Black is just getting a little older and she's slowing down a little bit and she's kind of tired and, you know, worn out. Happens to the best of us, am I right? And so for Miss Black, she's going to have 2 diagnosis codes based on this case study information. And the first one, the first main term that we are going to look up is malaise. The second main term we're going to look up for the second diagnosis is fatigue. So we're going to look those 2 up for her. Case 6, emergency department, 37-year-old female patient presents to the emergency department with abdominal pain. Pain is present in the right lower quadrant. So right now I can tell you pain is going to be a search term, a main term. Abdominal is going to be a modifier. Right lower quadrant is going to further modify that. And so she is having nausea and has vomited at least 4 times in the last 3 hours. So again, we're going to also look up the main term nausea because it looks like she's going to have 2 diagnosis codes. So nausea, and in that case, vomit with vomiting is going to be a modifier. So it's going to help us pick our code there. Case number 7. 76-year-old male returning to the office today to discuss a finding from a routine x-ray of his lungs. Radiology report states that there is a mass on his right lung. Left lung appears within normal limits. Patient was instructed that this mass should be biopsied and to rule out cancer of the lung. He agreed to the biopsy. So for case 7, the main term here is going to be mass. That is the actual condition. And it will be modified by the term, by its location, which is the lung, specifically the right lung. For case 8, inpatient gastroenterology consult note, 53-year-old male patient, weight loss over the last 3 months. He's experiencing consistent diarrhea. Has not had a baseline colonoscopy, so his primary care physician has asked this provider to complete one. Will complete colonoscopy later today to rule out cancer of colon and polyps. So for this patient, he also is going to have a couple of diagnoses. I can tell you from looking at this. So loss is going to be one main term that we are going to look up. Weight is going to be the modifier for that term. And also diarrhea. We need to look up his diarrhea. So he's got 2 conditions, weight loss and diarrhea. So we're going to have to look up both of those. All right, so he's going to have 2 main terms, loss and diarrhea, and weight is going to help you code this the main term loss. All right, so case 9, employment drug testing results. Oh, these are always fun. Scandalous. A blood sample was obtained from this 39-year-old male. The sample showed that there is cocaine in the blood sample. The employer's supervisor will be notified, and the employee will be sent for further evaluation. All right, so there's only really one thing we can look up here, which is cocaine. Cocaine, I'm sure that's going to end up coming up in some type of like abnormal substances in the blood. And so you may need to use blood as a modifier, but maybe not. So start with cocaine. For the last one, case 10, 74-year-old female patient presents to the office. Oh, goodness, excuse me. She says that over the last month she's experiencing chest pain when she takes deep breaths. Today the chest pain is more frequent than it has been. EKG is normal, BP 120/85, which is normal. Her lungs were clear to auscultation, no rales, rhonchi, or wheezing. Heart looks good, no masses. Generally, she looks okay. So it looks like her main term is going to be, again, pain. And her the terms that are going to modify that main term is this taking deep breaths, which is otherwise known as respiration. So I will type that in here for you. Okay, so that's what you're going to look up for these. You'll see if you're over to the right side, I've been looking up some of these, just a few of them to get you started and give you an idea of how this works. If you have any questions about these, let me know. Take care, everyone. Hey everyone, sorry, I'm trying to get this to stop moving. Okay, so in the code with me portion, We are going through these case studies for supplemental learning. And the first case study, the patient has a headache. We determined that headache is the main term that we need to look up. So we're going to start with our index, as we always do. And we are going to flip to the H's, E, F, G, H, oh, headache. Here we go. All right, so there wasn't any specific information about the type of headache, but you can see that there is headache types here and also here, but it just had general headache, and so I believe that's going to leave us with R51, and that is what we are going to look up in our tabular list. So we're going to go to the tabular list. Flip to the R's, elemental PQR, and we had decided R51. So all of the codes from these case studies are going to be in this chapter 18. So R51, one more page. We have over here, R51, we have headache, facial pain, not otherwise specified, so atypical facial pain. You got extra things here, but none of those meet it, so we are just going with R51. So for case 1, R51 is the code. Okay, moving on to case 2, we determined that the main terms that we should reference in the index are shortness. So I'm gonna go over here, G. Shortening, shortness. So we have that here. And then let me zoom in for you. Of breath. So R06.02. So again, we're going to flip back to those R's. And look for 06.02. 06. Here's 06. And we're going to zoom in here. So you can see R06.0 is dyspnea. It has some exclude notes here. And let's look for the type. So shortness, breath, 06.01. We said it was 02. And here we are. As R06.02, shortness of breath. And so that's going to be our diagnosis code for case 3. Okay, I'm going to skip around a little bit and go to case 5 and 6 because they have 2 diagnoses for each. So case 5 talks about Mrs. Black, who presents with malaise and fatigue. And so we're going to look up malaise first as the main term. LMN. MALA. Here we go. So here, malaise, let me find my little highlighter. R53.81 that we're going to verify when we flip back there. And then the other one is fatigue. And fatigue is R53.83. So we had R5381 and then R5383, okay? So we're gonna flip back to our R's. I stuck a little page flag back here so it would be easier. And we're gonna go to R50s. These look like S's. Oh, I'm in the wrong chapter, that's why. R's are 53 is what we're looking for, 0.81 and 0.83, 56, 53. Okay, so here we are, R53. And we have, sorry about the shaking, I keep bumping it. It's on like a, what's it called? Like a mount, and it just keeps moving. Okay, so R53 is malaise and fatigue. So we said 0.81 other malaise, which seems to apply to this patient. She was talking about how she's just generally fatigued and experiencing malaise. She's just getting older and out of energy. And so we have R53.81, and then we also need to verify R53.83, which is other fatigue. So fatigue not otherwise specified. And same thing over here for this malaise not otherwise specified. So those are going to be our two codes for case number 5. Okay, case number 6. We have abdominal pain in the right lower quadrant that we need to look up, and that she's vomited. She has nausea with vomiting is what it looks like. So again, we are going to go back up here, and the first thing we're going to look up is pain. Pain is the actual concern. Pain, okay. So pain starts over here, goes all the way over here, okay? And we are looking for abdominal pain specifically in the right lower quadrant. So pain, we're gonna go abdominal. And here we go, let me zoom this in for you. Abdominal pain, and we have lower right quadrant. So R1031 is the code we need to look up for that. And then they have a second diagnosis of nausea with vomiting. So we're gonna go look up nausea. O-M-N-O-P, back. Anybody else still do that? Say the whole alphabet to get to the letter you're at. Nausea. Nausea, okay. Here we go here. Nausea without vomiting is R11.0, but they said that she was vomiting, so with vomiting is R11.2. So again, we're gonna flip to our R's. And we are going to look up R10.31 to verify, and also R11.2. So R10.31, and here we go down here. R10.31, right lower quadrant pain. So that checks out. And then R11.2 is going to be right over here. I lied. Sorry about that. I'm knocking stuff off my desk. R11. Where the hell's R11? Is it under my flag? No. Oh, here. Oh my gosh. Okay, found it. Sorry for all the moving. R11.1, R11.2, nausea with vomiting unspecified. Persistent nausea with vomiting not otherwise specified. So that is going to be our code for case 6. So there you've got 3 or 4 examples of how to look up these codes for these case studies, and I'll leave you to it to do the rest of them. And it's just good extra practice. All right, take care, everyone.